So if you could start with a PKX001 compound, add it to the cord bloods at acquisition, and then keep them in it during the freezing process, that might help survival during their bench time, as well as enhancing their ability to come out alive from a frozen sample. If you've got a greater source of viable cells to transplant, you'll get a much better engraftment in the patient. So I'm Kelly McNagny. I'm a professor of medical genetics at University of British Columbia, and I'm an expert in immunology and hematopoietic stem cell biology. I'm also a member of the Stem Cell Network of Canada and a member of the Allergen Network of Canada. So I'm talking a bit about bone marrow transplantation. So you've probably heard in the popular press that there's lots of stem cell therapies that are making their way into the clinic. Really, bone marrow transplantation is the oldest and most well-tested stem cell therapy. And basically you use it to treat bone cancers, blood cancers, where you have to wipe out the existing blood cell compartment and replace it with a transplant. There's been over 1 million bone marrow transplants since they first started. About half of those are what they call autologous. That's where you take your own stem cells and hold them in reserve and then replace them after you've wiped out the cancer. The other half are from donors, non-autologous transplants. The biggest problem with bone marrow transplant is making sure that you've got enough cells to get good engraftment. So that means having enough of those precious stem cells that can reconstitute all of the blood system of the person you're transplanting. There's various sources you can use for them. You can use bone marrow from a donor. That's hard to get. It involves taking aspirates from the bone of a patient. It's not very pleasant. Another source that people are using much more frequently now is cord bloods. So when you take the blood from the umbilical cord of a baby, that's really enriched in hematopoietic stem cells. People are banking them now in biobanks. In Canada, we've got a large biobank for stem cells from cord blood, and you can use those to transplant. They're a lot easier to get. The problem with those, however, is that there's much fewer stem cells in a cord blood than there is in an adult bone marrow sample. So you can get only a limited number from a cord, and frequently there's not enough to transplant an adult person. You might be able to get away with young kids and pediatrics, but getting enough cord blood stem cells for an adult is a challenge. The other problem is there's no way to really expand them. So once you have them, it's been very, very difficult, and people have tried for decades to expand them as a new source, and that's been a real challenge. So what you want to do is optimize the harvesting of the stem cells and the preservation of the stem cells, and then use those to engraft a recipient. One thing that's interesting about that harvesting is that if you let the stem cells sit out too long, they tend to lose viability very quickly. And then when you try to thaw them again after a freeze, there's not enough left to engraft. So if you could find any way of better preserving the stem cells at harvest, and particularly during the freezing process, then you'd have a really good way of enhancing bone marrow transplantation. And that's something that I think we can address. So we're interested in the PKX001 compound, also known as AAGP, because that compound, at least in other cases, has been shown to enhance the freezing process and enhance the viability of cells you get back when you freeze them in that compound. So we're doing some studies with that, and it seems to also slow down the metabolism of the cells, and that might be another way of enhancing viability. If it enhances survival of cells that you've frozen and you could now thaw them back and have a greater viable sample, that would enhance engraftment. Or the other possibility is actually adding it to the cords as you acquire them before the freezing process, letting them sit for a while, and that might slow down the metabolism enough to enhance engraftment as well. And just think about, organ transplantation, where you've got to find a cord that matches the donor so you don't reject the transplant. It's a big challenge. So what you want to do is have the best bank of viable cells accessible and the highest number of cells that you can use for individuals for the transplant. If you could preserve the viability of one cord to the point where you only need one for an adult person rather than 2 or 3, that would change the way we do transplantation and help a lot of people.